I want to give each and every one of you a special welcome, but in particular, I like to recognize our own Minister of Health, who is here, the Honourable Marcella Liburd, and also our two permanent secretaries. Firstly, Mrs. Rochester in the Human Resource Management Department, and also Mr. Elvis Newton, who is our Chief Permanent Secretary, leading on the improvement of the public sector and carrying out in particular his duties as the Permanent Secretary in the Ministry of Foreign Affairs, etc. Firstly, I want to thank you for being here. I want to thank you not only for being here, but for the tremendous service that you have been providing to the people of St. Kitts and Nevis. I've had the opportunity to serve you as the Prime Minister of this country for several years. And there are particular moments throughout the years that I have served as the Prime Minister that will forever stand out as being very special and indeed unforgettable as some of the highlights in our own service. And the improvement in the medical insurance scheme that has been provided for you, the public servants, is one of those highlights which will stand out forever. I want in particular to recognize those who have made it possible. Firstly, the National Caribbean Insurance Company, our own indigenous insurance company, and which is being represented here this morning by Mrs. Byron and maybe others who may be here. I want to also commend those who have been negotiating from the Ministry of Finance, Mr. Calvin Edwards in particular, and also those from the Human Resource Management Department, that is Mrs. Rochester and her team. And finally, those who have come from the CGM Gallagher Insurance Brokers Company, led in particular by Mr. Rushford himself and Judy Barrow, both of whom are here with us today. I want to say that this is really a special moment because government employees are critically important to us. Your overall performance is important to the government and the people of St. Kitts and Nevis. Your performance is important for the entire well-being of our nation. I am very much aware that most of the important role that government employees play in the fulfillment of our dreams and aspirations of the thousands and thousands of our own nationals throughout this country. Because really people throughout our federation, they count on you, the government employees, to ensure that the policies of the government are properly implemented to do a number of things. Our people generally expect you, the employees, to provide for their physical safety in times of emergency, as police are called upon to do every day. They expect you and us as public servants to equip their children to compete in the world of work, thus preparing them in terms of their academic upliftment. They expect us to keep our public places clean and to ensure that proper taxes are levied And of course, those of you in particular who are in the health sector, they expect you to work to keep them from getting sick. And when they get sick, they rely on you again to get them back to good health. And I believe that apart from the fact that they also expect us to provide food as farmers and so forth, they wanted us to ensure, our general population want us to ensure that we would do all in our power to provide the caliber of medical benefits that would assist you, our public servants, in doing your duties to serve the interest of our country. And that is why we have to ensure that you yourselves are kept well. In the event, however, that you fall ill, you must be able to rely on the government, the insurance company with the government, to give you the necessary benefits that you will expect so that you can improve on the quality of your own health, the quality of your life, and you can get back to the point where you can continue to serve the interest of our fellow men. I want to emphasize that government has long been committed to freeing public employees from the dread and the weight so heavily carried in the hearts by millions of people around the world. The fear of a loved one developing a very costly illness, the fear of being unable to treat that illness adequately because the money is just not there, or the dread and the fear that you may have to see a member of your own family being seriously ill and you're not able to muster the money to pay the medical cost of bringing that loved one back to good health. It is a dread that I know you have, because I myself in the past have had that same dread. I remember being very ill a few years ago and having to call upon Mrs. Byron, asking her from where I was, what assistance can I depend upon the National Caribbean Insurance to provide so that I could be allowed the kind of surgical intervention which was necessary in order to bring me back to good health. So I understand exactly what that means. And this is not a very good experience for anyone to have. And it was against this dreaded experience that my government has been working so hard to insulate those whose work promotes the smooth running of the government. Because you, in a way, work to ensure that the government runs smoothly. And so I want to thank you again for the services that you continue to provide, and to thank all those who have been involved in the negotiations that have brought us to where we are today. And that is why, for these reasons, I began by saying how very important it is for me to be able to officially support what is happening as an improvement in the medical service that is being provided by the insurance company to improve your health and provide you with the benefits that you need in order to continue to serve as public servants here in St. Kitts and Nevis. This development and expansion in the benefits that you have is all entirely to be paid by the government. Mr. Rushford a while ago has gone through the benefits that you will now receive. He has looked at what it was and what it will now be. And in many cases, there are significant improvements in what we have had before. I want you to permit me just to emphasize some of the new things that have been added to your coverage. Firstly, there's life insurance coverage of $10,000. That was not there before. It is now there. And if by chance you happen to fall ill and you do not recover from your illness, those who are left behind would at least have $10,000 coverage for helping them to go through that painful period of adjustment after you would have gone. Then there is, as he explained, and which is new, the accidental death and dismemberment coverage of also $10,000. And he explained that this could be very much different from other compensation that you already would be due based on existing laws that govern the conditions under which you are working. But there is something new to all of that, and it is the accidental death and dismemberment. That is, if you lose a limb or part of a limb, you would be able to be covered by a new $10,000. Something also very new, which is very dear to my heart as a medical doctor, and that is those persons who have been affected by AIDS. There was no coverage at all for such patients before. We are now making it mandatory in the relationship that we have with the insurance company, that persons who among us are health workers or public servants generally and have contracted the virus and are now suffering from the results of that virus, which is AIDS, they would be able to rely upon the new arrangement, and they can be provided $50,000 for coverage. We are also putting in place something new. It is the annual physical examination. We believe very strongly that every public servant and everybody in general should be able to have an annual general checkup by your doctor without you having to go through the financial stress of having it done. And so we are covering this. We are saying to you, for God's sake, don't wait until you're sick. Every year, identify the time when you would go to your doctor and have a medical checkup. It is covered by your insurance company. The government has already paid for it. Don't let it waste. Go to the doctor every year and have your checkup. It is then you may notice that you have diabetes, hypertension, or you may have some other serious illness, which if we can tackle it early and on time, we might be able to prevent it from spreading and getting worse, and thus threaten your life. For God's sake, I beg you, do your annual physical checkup. I've insisted that this be included because I know, again, as a medical doctor, how important this is. do the annual physical examination, because it is now paid for in advance by your government, and we want you to benefit from it. The ambulance services. Many persons, very, very ill, can get better if they can get to a center overseas. But the cost of flying out to go to that center abroad, thousands upon thousands of dollars. Today, the government is saying to you that no longer is a barrier for you to get to overseas medical centers where you can have an improved medical assistance. The ambulance is being provided for you. It's already been paid for. So therefore, you will now have access to this to fly you out, as they would say, so that you can get medical attention that is not available here in St. Kitts and Nevis for various reasons. And then dental and vision care. So many times you're told, well, you can get your checkup and so forth, but anything to do with dental or your teeth or your mouth or your eyes and your vision, that ain't cover. You have to cover that yourself. No longer can they say that to you. You have poor sight, poor vision. For God's sake, go and get your eyes checked and get your glasses. The government will pay that for you. If you have bad teeth, go and get your mouth checked, because now the government is paying that for you. Clean up your mouth so that you can benefit from all that the government is providing for you. We want, when you smile, you have a nice smile. You don't want any rotten teeth. Go and take them out, because the government is providing the assistance to the insurance company for you to clean up yourselves. We want you to look nice and dandy. And there is an increase in the medical insurance benefit. It used to be $100,000 for serious illnesses. Now that has been raised, you hear, no longer from $100,000, because sometimes one little procedure can cost $100,000. Today, thousands upon thousands of dollars are required. And we have moved this from $100,000 cost for the medical service you will get, surgery, etc., to $750,000. $750,000. Because I know the pain that you've had when the treatment of cancer. We've had so many cases of our public servants having to have fallen ill, in particular with cancer. The treatment is expensive, and a lot of our people have died. We want to give you the benefit of living longer. And so we have moved this from $100,000 coverage to $750,000. $750,000 is $750,000, and this is going to be renewable every 3 years. Again, I want to commend the insurance company for working with us to make this possible. And all of this, as I said, is already paid for, as you are public servants. That is why I have said to the Human Resource Department, when anybody becomes employed in the government, they must ensure that they immediately get onto the medical insurance scheme that the government provides so that you can benefit. Too many of our people have been working and they don't even know they have the right to be covered by insurance. We want that nonsense to come to an end. Once any of our people become employed to the government, you must also ask your fellow worker who is coming onto the job for the first time, have you been covered by the medical insurance scheme? Did they give you your card? Make sure you ask your fellow workers that, so that we can have a close collaboration between the Human Resource Management Department and you, the worker, or your fellow workers who may get involved in the public service in the future. And all this is being paid for, as I said, without requiring even 1 cent from you. And we've done this at this time in particular because we know that things are hard. Things are difficult. And when things are difficult and you get sick, it gets triple hard. And that is why we are saying we can't expect you to take the little money that you're getting. We have to give you assistance in some other way. And we have found that assistance through working with the insurance company. I can't increase your salaries right now because you know how things are, but they're going to come. But until that comes, you will benefit from the medical insurance scheme that we have. Your wage increase will come. Your salary increase will come. But until it comes, this is something for the time being. Because we understand how things are. Things are difficult. Things are difficult all over the world. Not just here. Don't worry with them who talk. All over the world, things difficult. All over the world. But which government is in the Caribbean is doing this that we are doing today? None. And this is because we believe that we have to look after the interest of our employees despite the difficulties we are experiencing. I want to say finally in closing that with all that the government is working closely to achieve for you, working closely with others, what it is that the government expects of you as employees. What it is we are asking for you to do in return as we give you something extra for the hard work that you do. We are asking for a renewed commitment to courtesy and civility in dealing with your co-workers and with the public that we are serving. I want you to pay attention to that. How you relate to your fellow workers and how you relate to the public that you are serving. I know you may leave home very much upset over something, but for God's sake, don't take it out on the people that work in with you and who you are serving. Treat them with courtesy and with civility. Treat them with respect and respect yourselves in the process. I also ask, as the government, we ask for a renewed commitment to excellence in the time that we commit and quality of work that we are producing. Excellence and improved quality. Excellence and improved quality. Do your best. Do your best. Cut out the idleness. Work harder because your government is working hard for you. For God's sake, let it be a partnership. You work, you serve, and you become properly compensated. And thirdly, we ask for a commitment to faithfully schedule, as I said before, your annual checkups. Imagine that. I'm begging you to do your annual checkup, because your checkup is now paid for in advance and it's free. Even when you are feeling strong and healthy, you don't know what's going on inside there. Go and find out if the way you feel, if it is the way your body really is. Sometimes you feel real good, but inside ain't good at all. And sometimes you think that inside is not good, and you become depressed, and you become mentally ill because you have feelings inside that things ain't right inside, and you go to the doctor and he will tell you things are right, you're just anxious. Settle down, things okay. That is important as well, for you to be given the okay by your doctor that things are well, even though you may not feel very, very well. I want you to always remember that an ounce of prevention is far superior to 10 pounds of cure. There are many questions that you will have, I know, and the Human Resource Department will be more than pleased to answer any question that you may have on the technical or the administrative dimensions of this plan. In fact, John is still here, and he says from what he has presented earlier, he would expect you to ask questions. What I wanted to do today was to make the time to impress upon you the following. One, what an important undertaking my government sees this step forward to be. Two, what a very powerful indication this is of the depth of appreciation that the government has for all those who work within our public service. And three, the commitment on the part of the government to do all that it can to improve the conditions of work for public employees, expecting at the same time that public employees will do all in their power to honor and to serve the people of this nation, in order that we might together ensure that St. Kitts and Nevis becomes all that it can truly be. I want to ask God's blessings on you as we continue to serve our people. Thank you.